And thank you. April is Head and Neck Cancer Awareness Month, and joining us to talk about what we can do to prevent those cancers is Sarah Simon, a health speech therapist with SSM Health. Thank you so much for being here.
Thank you for having me.
Yeah. Sarah, let's start pretty broad. For people who don't know, what are head and neck cancers and who's at risk?
Sure. So head and neck cancers include cancers of the mouth, lips, tongue, throat, or voice box, and less commonly cancers of the sinuses, nasal cavity, and salivary glands. And risk factors really include alcohol and/or tobacco use, HPV infection, exposure to toxic substances or radiation, and genetics as well.
So what are the signs and symptoms that people should be looking out for?
Yeah, so things to pay attention to: a lump or sore in the mouth or throat that just doesn't heal, a persistent sore throat, difficulty swallowing, sometimes difficulty breathing, changes in voice quality such as hoarseness, ear pain, and unexplained weight loss.
Yeah, if someone notices those symptoms, they go to their doctor and it turns out they do have cancer. Are these cancers treatable?
Yes, there are a variety of treatment options: surgery to remove the cancer, radiation therapy, chemotherapy, or some combination of those treatments.
And if someone is diagnosed with one of these cancers, what support groups and resources are available to them?
They are plentiful. There are a lot of online resources as well as online support groups, and there's actually a local support group that meets in Waunakee, the Wisconsin South Central Head and Neck Cancer Support Group.
When we talk about, the types of cancers that are out there, how common are these types of cancers?
Head and neck cancers account for roughly 4% of all cancers, so a fairly small subset, but they're definitely out there.
We had talked in the break before about some of the things that you're doing to help treat people when they get the diagnosis, but before they actually go through that treatment process. So what are some of those things?
Yeah, so as a speech therapist, I get really involved with the swallow function of patients that are undergoing radiation therapy in particular. So radiation can really cause stiffening and scar tissue of this area. So we really want to meet with patients before they begin radiation to give them preventative swallowing exercises to help stretch and strengthen, the swallow mechanism before, during, and especially after radiation therapy ends.
I actually had a family friend growing up who had cancer of the tongue, and then went through all the treatment and surgery and all of that, and has gone on to live a really happy long life. But it is a difficult process through that treatment, and for the patient and for the families.
Definitely.
So definitely worth getting the help for those resources and support groups as well.
Yeah.
Well, great information today. Thank you so much for being here to share.
Thank you so much for having me again. Thanks.